Onrise was inspired by years of watching athletes not have the care that they needed. It was inspired by my own experience. It was inspired by the experience of my patients and of my family. I have a collegiate soccer player, and I watched the difficulties that he and his group went through in recruiting and walking into collegiate athletics all through youth. And it's just a hard thing to explain. And if you don't get it, it's really hard to understand what they have to go through.
One thing I want athletes to know about me and my commitment to Onrise is we created this because it's something that we wish as athletes we would have had when we were in their shoes. And this model is a true model that's for the athlete by the athlete, because we've been there, done it, lived it, and made it through the other side. This is a resource that they can trust and depend on, because it's athletes who's been in their shoes, lived their life, and they can learn from those same situations and mistakes and still have that same success in their life after sports or their life doing sports as well.
So the Onrise Network is fantastic because we have a wide range of athletes that are former collegiate athletes, professional athletes, international athletes, so Olympic level athletes. And it's fantastic because it's all different types of sports. The athletes love actually seeing somebody that played a different sport, because they can still connect to the experience.
So we tailor our programs because we know that sports organizations are all different, right? Whether it's leagues, teams, players associations, athletic departments, or programs, there's different sizes, there's different budgets and different needs, right? So we need to be flexible on our end to make sure that we're tailoring that for the groups that we're working with. So from peer support to sports performance, therapy, psychiatry, crisis care, to educational programming, mental health first aid certification. There's a lot of different options where Onrise can come in and fill those gaps that exist for sports organizations.
I mean, at the end of the day, it's saving lives, right? A lot of this work that we do, unlike traditional setups in healthcare, is preventative, right? Not only are we preventative, but also we can help a lot of the things that athletes have been dealing with for a long time, whether that's something they've been going through in childhood and they're ready to take on now that they're a little bit older, or maybe just really small things. It's 25-minute conversation about how their week's going and that their partner might be frustrating them, or a teammate. So we're really here for everything from preventative to care after the fact, but also all those steps in between.